Welcome to the CE on Supervision. I'm Dr. Barry Nierenberg, the Center of Psychological Studies here at Nova Southeastern University. I wanted to start out this module on why we even need to have a CE on supervision. And it would seem at first glance that supervision is really easy. I've had colleagues, and perhaps you have too, who have said, I don't understand why it's so difficult. I'm a supervisor, my students come in, and I tell them what to do, then they go out and do it. That's supervision. Well, that is certainly one type of supervision. But what I wanted to go over today is what are the good elements of supervision and how can we use it to inform the development of our supervisees. So first, why do we need a CE on supervision? It's hard to think about a psychologist not doing it at some point. Also, in recent years, there has been a lot of work done on supervision. We now have data on what works and what doesn't, and we now have models that we can use. And this is fairly recent. So within the CE, we'll be going over some of those. And also the American Psychological Association has been paying much closer attention to supervision and how it's conducted, because they really want to raise the level of supervision up. And one of the things that they're focusing on in a similar way that they're doing with classroom-based teaching is they're looking at competencies. Now, until recently, supervision was not taught, and most supervisors, especially ones of my generation, tend to do supervision the way we were supervised. And we can increase supervisors' competence by teaching the models, by sharing the research data, and by your tuning into this CE. So let's talk about what supervision should be. It should be an intervention that's provided by a more senior member of a profession to a more junior member of the same profession. This relationship is evaluative, it extends over time, and has simultaneous purposes of enhancing the professional functioning of the junior member, monitoring the quality of the professional services that's rendered to the junior member's clients, and serving as a gatekeeper for those who are in the process of entering our profession. But it doesn't stop there. Supervision goes on. So according to Founder and Shafransky, editors of a 2008 textbook published by the American Psychological Association, supervision to them is defined as a distinct professional activity in which education and training aimed at developing a science-informed practice are facilitated through a collaborative interpersonal process. It involves observation, evaluation, feedback, and facilitation of supervisee self-assessment. You have to be a good supervisor will observe what's going on, will have a way of evaluating it that hopefully is more than just subjective, will have a way of giving feedback back to the supervisee about how they can get better. And the whole goal of being a supervisor is to help your supervisee to do their own accurate self-assessment. We also want to help our supervisees acquire knowledge and skills by straight-out instruction within the context of supervision, by modeling how people should act, and by mutual problem solving. In addition, by building on the recognition of the strengths and talents of the supervisee. Supervision encourages self-efficacy. As you can see, strengths, talents is underlined, and the whole thing is bolded. part of being a supervisor is showing your supervisee what they're doing right. That's part of the self-assessment. That's part of our assessment. And this is conducted in a competent manner in which ethical standards, legal prescriptions, and professional practices are all used together to promote and protect the welfare of the client, the profession, and society at large. That's why we have the gatekeeper function in there. So, supervision has clinical aspects, legal aspects, and ethical aspects, each of which needs to be considered in the encounter. Clinical supervision is the primary means by which psychologists and their supervisees ensure their legal and ethical responsibilities to clients, profession, and the public. So now we have a beginning understanding of why supervision is much more complicated than supervisees coming into us and we tell them what to do and we evaluate how well they do it. That does not pay attention to the breadth of the supervisory process that we've just discussed. And by the way, this is why it's helpful to have a CE on it. So, understanding supervision. If we want to understand supervision, it's important to be able to get into some of the foundations. So supervision is really based on the supervisory relationship, a spirit of inquiry, and educational praxis. Praxis refers to the process by which we take theory and put it into practice. Each of these three interacts and affects the other two. So let's start with the supervisory relationship. This provides the foundation of the alliance in which the individual and shared responsibilities in the supervision of clinical practice will be achieved. The supervisory relationship is the vehicle by which everything happens. It's one reason why it's very important in the beginning to spell out expectations and responsibilities at the very start of the process. And we'll be going over this. It's important to note, by the way, that for at least the past 2 years, in Florida, it has been part of the statute for supervisors to be required to have a supervisory contract at the beginning of supervision that does exactly this, spells out all the expectations. The spirit of inquiry. This refers to the portion of supervision that facilitates the critical understanding of the therapeutic content and process. As we know as psychologists, when we're training supervisees, they have to pay attention to and juggle both. And since they're inexperienced, this can be very difficult. And they're anxious. So it's easy for them to only focus usually on one or the other of content and process. And if as supervisors we can facilitate and enhance a spirit of inquiry into how to balance both, then the supervisees that we're training have the possibility of becoming much more talented psychologists. This spirit of inquiry also fosters in the supervisee an enhanced awareness of professional and personal contributions. So it's not only focusing on the client. As psychologists, we understand that our greatest tool is ourselves. And if we can bring this spirit of inquiry to our supervisees and help them to understand the strengths and weaknesses, the unique strengths and weaknesses that they're bringing to the table, they will be much more self-aware and will be much more able to do supervision in a manner that plays to their strengths. So educational praxis, this is where we as supervisors assist our supervisees in applying theory to practice. One of my favorite quotes is by Jan de Schnepschut. In theory, there's no difference between theory and practice, but in practice there is. that road about how to bring theory into practice, how to take what you've learned in the classroom and actually bring it to the patient sitting in front of you within the therapeutic hour, can be very, very daunting. And that's where we come in as supervisors. So I mentioned before that APE in particular, and Founder and Shafransky specifically, as well as others, have begun to talk about competency-based supervision. Competency-based supervision really refers to what are the competencies, what are we really teaching? If supervision is teaching, what are we teaching our supervisees, and why are we doing it? So the very first point on the slide is that consumer protection and quality assurance. If they're competent, then we can have some data, depending on how we assess the competencies, on the consumer being protected and having some degree of quality assurance in the type of therapy that's being provided. There's an increased focus on evidence-based practice, what really works and how do we know what works. As one of my old mentors told me once, there's a huge difference between what we believe and what we know. What we know has data. How do we help our supervisees, by the way, make the jump from being a supervisee to being a supervisor? And to some, supervision is increasingly viewed as the very key to implement the training that we give to psychologists, and it's a key for the fidelity and transportability of evidence-based treatments. When we're trying to help patients who are struggling and in pain, sometimes they need more than just a nice shoulder. You don't need to pay a psychologist to be a nice shoulder. So what does the research say? What do the data have to say about what works and what doesn't? And how can we assist our supervisees in taking that knowledge and applying it within the therapeutic context? This process has been referred to by some as evidence-based practice versus practice-based evidence. It's one thing in a randomized controlled study within the sterile halls of a university to come up with some data about what works and what doesn't. But in the real world, when you're sitting with a patient, you have some sense of what works and what doesn't for this particular patient. In research, we're looking at group effects, but in therapy, we only want to affect the person sitting in front of us. So, for example, there's a lot of evidence that for depression, cognitive behavioral therapy is the way to go. Well, there may be reasons why, for this particular individual who's in front of you, it may or may not actually work. So you need to know what other choices are there, and that's practice-based evidence. Now, we've talked about supervision as teaching. So if you think about elements of supervision and you think about elements of education, there are similarities. They both involve teaching and learning. They both involve evaluating and giving feedback. The difference is there's a uniform curriculum in education. There's a syllabus. And there may or may not be in supervision. Supervision versus therapy. This is a crucial distinction. There are similarities. They both involve helping somebody. Therapy is helping a client. Supervision is helping your supervisee. You're helping them to examine their behavior. You're helping them to examine their thoughts and their feelings. But therapeutic intervention with a supervisee should only be done in the service of helping the trainee to become more effective with their clients. There are important differences between supervision and therapy. Supervisees are typically not given a choice about who they're going to receive supervision from and who will deliver the supervision. Whereas in therapy, you're free to choose whoever you like. There's a differing initial contract. Therapy involves helping someone with personal issues, while supervision focuses on professional ones. So not long ago, I had a supervisee who was telling me about a case. And she said that she had particular difficulties with her patient because the patient became very angry at her. And she turned to me and she said, and I have particular difficulty handling anger. And she began to talk about how that was an issue for her from her family of origin. If I was her therapist, absolutely, I would get into the issues around her having difficulties with anger stemming from her family experiences. I was not her therapist, I was her supervisor. As her supervisor, I paid attention to the bolded part of the preceding paragraph. Therapeutic intervention should only be done in the service of helping the trainee to become more effective with their clients. So my focus was not on what happened to her when she was a child, how it's affecting her now. My focus instead was, as a psychologist, how can she handle anger within the therapeutic context? And we talked about various and sundry techniques, and a few weeks later, she very proudly talked to me about another case where the patient became furious in the waiting room, screamed at her in front of everybody, and she handled it a lot like a psychologist. That's the difference. And it's very important to remember, because as supervisors, we also do therapy. We've also had years of experience of doing therapy. And it's easy to slide into that. And the takeaway from this slide is don't do it. You're helping them become a psychologist. You're not helping them with their personal issues.